For those of you who have just joined us, I granted you permission to record. Let me know if you are having any trouble being able to record to your local files. Chat is open and will be open. Hi, Michael. Great question. Should we ask questions in the chat or by raising our hand? Oh, wow. We have 26 participants. So let's raise hands, please. And in the past, we've just kind of done a popcorn, people chime in, but in the pursuit of organization, if you just want to raise your hand and I'll call on you, and then you can also throw questions in the chat if you're having audio or tech trouble, but we'll try the hand raising option as opposed to the popcorn official phrase. So, and with that, Michael, you will be the first one I call on. So thank you for leading us off.
Sure, you're welcome. My question is relating to the at-home tests that are...
I'm so sorry, though. I'm going to have to interrupt you first because we are just waiting on, even though I love your timeliness, at noon on the dot, we are waiting for Lacey and Dr. Kwan to get in here. So if you can just stand by briefly until I give you the all clear.
Oh, okay.
Thank you. Stand by, Keith, giving you those permissions. You're next. Thank you. I know it's 12:01, everyone. Thanks for your patience. We're just standing by until Lacey and Dr. Kwan join us. Oh, I see Lacey here. There she is. Lacey, may I get audio and... Oh, and there's Dr. Kwan as well. We did not coordinate our turtlenecks.
Afternoon, everybody.
Good afternoon. You look great. And Lacey, I see and hear you. You look great as well. Thank you so much. All right, we'll get started. I am also going to make sure that the speaker is spotlighted so you guys can pull appropriate clips. So welcome everyone and thank you. It's 12:02. I'm Julie Grauert, Public Information Officer, and this is immediate availability. We've had several news releases go out in the last few days, and we wanted to give you access to some of DOH's leadership to answer your questions. So what we're going to do this time, because there are 38 of us on this, if you could please raise your hand, and then I will call on you, as opposed to the prior format where we've just done the popcorn shout it out. So we are going to start with Michael, and then Ryan, looks like you are the next one, and Lacey and Dr. Kwanget are here for you and ready to answer your questions. So Michael, please.
Thank you.
Kick us off.
Thank you. Michael Whitney with the Snohomish County Tribune newspaper. I had a question on the federal at-home tests. The White House published that the administration will set up a website where people can order the tests by mail. That's coming in January. Has the Department of Health been told yet whether or not it will be involved in this distribution chain?
Thanks for the question, Michael. I can start. I'm Lacey Fehrenbach. I'm the Deputy Secretary for COVID-19 response. So our understanding is this will be a direct federal to consumer program, meaning the state would not necessarily be directly involved. We are hoping to get a sense from the federal government about how many tests are coming into our state through this channel. And we are also looking at avenues as a state to provide direct to consumer access to at-home tests through ordering systems, as well as for people who have low incomes or who may not be tech savvy, through community-based organizations and local public health.
Great. Our next question comes from Ryan at KIRO Radio. Go ahead, Ryan.
All right, thank you, Julie. I'm just wondering, with this new guidance from the CDC that says, isolate, or, you can isolate for 5 days and then emerge and then wear a mask for another 5 days. Are you concerned that that sends a mixed message about mask wearing when we go out, when we should all be wearing masks when we're around other people anyway?
So this is a great question, and actually I really appreciate the question, and want to note that in our media release that signaled we will adopt the CDC's isolation and quarantine guidance, we do note that mask wearing should continue after and beyond your isolation and quarantine period in any indoor public setting. And I would also say we recommend for all Washingtonians, including those not emerging from isolation and quarantine, to wear high quality, good fitting masks right now, given the level of disease that we're seeing and the infectiousness of the Omicron variant. Dr. Kwanget, do you want to add anything?
I agree. I think the only thing I would add is that the Omicron variant does have more ability to aerosolize than prior variants. And so that means that it can more easily escape regular surgical masks. And so that's why it's not only important to be conscious of masking and masking in indoor public spaces, as Lacey said, even after the isolation and quarantine period is over, but also to up our game in terms of the quality of masks that we're wearing. So preferably wear a KN95 or KF64, or KF94, or if you are wearing a surgical mask, to double mask and not just wear a single mask. So yeah, so I'm really glad you raised that issue, because masking is something that we need to continue doing, and the CDC guidelines don't affect the mask guidance that we have. If anything, Omicron just makes it even more important for us to follow masking guidance.
Thank you. Our next question comes from Jenn at the Seattle Times.
Hello, thank you for taking our questions. My question is regarding to education. And last year, the state kind of used this threshold for cases to population infection rates about whether schools will be open for students in person. But this year there doesn't seem to be that standard metric anymore. And I'm wondering, what data are you watching what would give you concern to signal to schools that, you know, infection rates have become unsafe. We see colleges voluntarily delaying their in-person return, but K-12 schools are planning to go back in person after the winter break.
Thanks for the question, Jen. I can start, and Dr. Kwangyet can add. So we, based on evolving science throughout the pandemic, really pivoted as a state in the spring of last year to really emphasize keeping kids in school so long as it was as safe as possible to do so, and felt that we could do that even in the midst of high disease based on the very strong protection we have with layered mitigation measures that are required in schools in Washington state. So things like wearing masks universally, regardless of vaccination status, distancing to the degree possible, maximizing ventilation, and being ready to respond when there are cases, and certainly, and really importantly, keeping kids and staff home when they're sick. So we did move away from those metrics, as you noted, and the way that we have handled transitions to remote learning on a temporary basis for K-12 students is to really handle it based on the situation in the school, meaning when there are signs of an outbreak, that is when you make the transition. And because of the really important value from an education standpoint, as well as health impacts, mental, behavioral health impacts, as well as access to nutrition and human development, we really encourage schools to handle it on at the lowest level possible, meaning if there's an outbreak that only affects a classroom, that class temporarily transitions to remote learning. If it's multiple classrooms, you might have to do a whole school. And then if it's multiple schools in the district, you would send the whole district into remote learning. But at this time, we are hoping and planning that our students will be in person to the greatest extent possible, and that temporary transition to distance learning would be done at the local level based on transmission happening in the school or the school community.
Hi there, it's Deedee here with KIRO 7. Thanks so much for taking time to take a few questions. I have a two-parter. One is we just heard from you, Medicine, that they won't be able to accommodate testing for people who are asymptomatic or have not had exposures because of the sheer number of positive tests. I was just wondering, how concerning is that for the DOH in terms of, both what's going on, but also not seeing all of those numbers reflected, though we'll certainly see positivity rates. And then the other question is, the CDC director said part of the reason for the change in guidance is because of the economy and for business reasons, and staffing reasons for shortening that quarantine time. Is that also part of why the DOH decided to follow CDC's guidelines?
Maybe I can take an initial stab at your first question and then allow Lacey to follow up. So yes, we have heard about overload of the testing systems in many laboratories. As far as surveillance for Omicron, we at the state are shifting to, or have shifted to, a strategy where instead of trying to count every single Omicron case, we're trying to get a better picture of what proportion of positive cases in the state are due to the Omicron variant. And so to do that, we are testing a sample of variants and sending them for complete genomic sequencing to determine if they're from the Omicron variant. And so this is something we've been doing throughout the pandemic. It's not something new with Omicron. Initially, we were very focused on counting Omicron cases when we were trying to gauge, how quickly is Omicron establishing a foothold in the state. Now that we see that Omicron is quickly becoming the dominant variant in the state, we've shifted gears from counting individual Omicron cases to sampling a percentage of all cases for genomic sampling. So while testing capacity at any lab is a cause for concern, I think the overall the main metric we're following, which is the percentage of cases that are Omicron, is something we'll be able to continue. Is there anything that you would add to that?
Lacey, did we?
On the,
oh, no, there you are.
Yeah, I'm here. Sorry. On the second question, so I do understand, and I had heard the similar report from the CDC. I do want to emphasize that this is grounded in science. The majority of transmission does occur early in the course of illness. I think, if I remember correctly, generally the 1 to 2 days prior to onset of symptoms, and then in the few days after. So this transition for shortened isolation and quarantine is grounded in science, and also helps society keep running. And that is also important in a pandemic.
Thank you. Rebecca, go ahead.
Hi, I'm Rebecca with Spokane Public Radio. And my question is, with the rise of Omicron and the difficulty in getting tested, even if you are vaccinated or even if you're already boosted, when we have sort of New Year's gatherings this weekend, is this maybe with all of these factors, is it better to stay home or keep your gathering extremely limited? What are you advising people going into New Year's with all of these factors to potentially do?
Yeah, this is something that I think, as with guidance throughout the pandemic, that everybody will have to kind of individualize for their own particular situation and their family situation. Everybody has a different tolerance for risk, and different people and different families are different risks for severe outcomes from COVID-19. So if you are an individual, or if you have family members who, because of age or chronic conditions such as immunosuppression, that are at high risk for hospitalization and severe disease from COVID-19, then I would take great care and maybe err on the side of staying home and limiting your interactions and limiting your journeys out home to just what's essential. And then when you do need to go outside and in public, to wear a high quality mask and socially distance. So while I don't think this is something that we say everybody should cancel their New Year's plans, I do think everybody needs to be aware that the Omicron variant is highly contagious, much more contagious than the Delta variant. And that if you are at risk or have family members at risk for severe disease to COVID-19, to really consider that as you decide on your risk tolerance and prevention measures.
Lisa, go ahead.
Yes, hi there. I'm Lisa Balick with Coin TV in Portland. My question is, with the high transmission rate of Omicron and the low vaccination rate of kids, should parents plan on schools quite likely having to shut down at some point? And part two on that is, what will be the threshold, especially if it's left to each district to decide on their own? Is the state at some point going to put in some kind of a threshold?
So I can start. I think, one, we want to encourage all parents to, if they have not got their kids vaccinated, to do so, those children that are eligible, 5 and older. I also want to say we are encouraged by what we have seen in terms of vaccination among the pediatric population. So, start with that. I do think we are likely to see some classroom or school closures given the level of disease out there. As I mentioned earlier, we don't have a set disease threshold. It is based on the definition of an outbreak. So for a classroom, that is 3 cases or 10% of the classroom. And The other aspects that can contribute into a potential closure of a classroom or a school are the availability of staff to support the general operations of the school and health and safety of the students. So those are factors and decisions that are made at the local level.
Dr. Kwangit, do you have anything to add?
No, nothing to add.
All right, thank you. Tammy, go ahead.
Hi, good afternoon. Thank you so much for your time. I'm just following up to Deedee's question about UW announcing that they're going to be scaling back testing capacity unless you have symptoms or you've been exposed to COVID-19. You know, the message has been get tested if you're traveling, get tested for the holidays, get tested. So what are you guys recommending people to do to stay, I mean, if they're trying to stay safe, because UW is one of the biggest testing partners in this region. And so if they're scaling back that testing capacity, what is everybody else supposed to do? Thanks.
Thanks, Tammy. Just a reminder that there are a variety of places to get tested. We certainly appreciate our partners at the University of Washington and a number of major healthcare systems that are providing testing services to the public. There are also test sites, mobile and fixed, that are run by local public health or community-based organizations. There's testing available at pharmacies. And then, of course, as you all are aware, there are at-home tests that are coming online in greater capacity and are available for purchase in pharmacies and other retail outlets, including some online. We know also that demand for at-home tests is very high. So, you know, it's always helpful to have some on hand for when you need them. But we do encourage people, especially if they're testing for travel or gatherings and there's not a particular type of test required for their destination, that they really avail themselves to at-home tests so that those community-based sites and healthcare system sites that are really focused on diagnostic testing, so people with symptoms or people who are close contacts, can prioritize those patients.
Thank you. Our next question comes from Janelle. Go ahead.
Hi.
Janelle, it's very hard to hear you.
Oh, so sorry.
Oh, that's better.
Is this better?
Yes, that is better.
Okay, sorry about that. Thanks again for taking our questions today. I wanted to know a little bit more, since we're on the topic of testing. Testing in Eastern Washington, will we see any expansion? And then also talking about mass vaccination sites. There's one over in Western Washington. Will we see one in Eastern Washington anytime soon?
I can start. I think I caught most of that. I think it was a question about access to testing in Eastern Washington and maybe a question about mass vaccination sites. So one thing, I will get to Julie the link to a website that we have on DOH's site that guides people to testing locations near them, and that's for the whole state. So we'll get that out to you all. DOH does have a process. We work with local public health for citing mobile clinics, both vaccine and testing, as well as vaccine. And I will say we are talking with partners in Eastern Washington on this. At this time, I'm not aware that we have plans to put a mass vaccination site out in Eastern Washington. But we are monitoring both supply and demand of vaccines across the state and also testing across the state to see where we can position all of our resources, mobile testing teams, our caravan mobile vaccine teams, as well as the more high throughput sites, because we number one, if people want a vaccine, we want them to be able to access one. And if they need a test, we want them to the greatest extent possible to be able to be tested in a timely manner.
It is 12:22 and we have 4 reporters left in the queue. We are going next to Keith.
Following on the vaccine availability, we're still hearing people anecdotally saying they're having a hard time, especially trying to find a booster. That now that Omicron is out there, that people are really interested in that. You say you're not going to expand the mass vaccination sites, but what are you doing to increase the supply and availability, and what strategies do you have for people to be able to not have to go to different counties to try to find it?
Just a point of clarification. I think the prior reporter, I understood her question of, are you putting a mass vaccination site in Eastern Washington? And so at this point, we do not have a plan to add a mass vaccination site in Eastern Washington. We are looking at possibly a second location in Western Washington. I did want to note that we have expanded the capacity at the King County DOH FEMA site in South King County. So there is hopefully increased access there. They're providing all 3 vaccines. And then, we also have been working to get as much vaccine as we can into Washington State. We are very challenged this week by the weather. It's impacting testing and vaccine access, to be very honest. And we're balancing that and hoping to catch up as quickly as possible when the roads are safer and a lot of the outdoor sites can be more operational and people will come out to them.
Thank you. Our next question comes from Nicole. Go ahead.
Hi, good afternoon. I'm wondering what percentage of new cases and hospitalizations are breakthrough cases, if you know that. And then considering that the first vaccinations happened a year ago now, at what point will our vaccination cards be considered invalid or too old if we don't have boosters?
We do have a publicly available report on breakthrough vaccination. I don't have that. I don't have those numbers at my fingertips, but I can get that to you after the mini briefing.
And on the second question, there's not a point at which your card becomes invalid. Just to clarify, the card is a documentation of the vaccines that you have received. What could change as we learn more science is what the CDC considers complete for a series based on age or health risk status and what we know about the number of doses needed. So, at this point, there's not a change. So your cards are still valid, even if they're a year old. 2 doses is considered fully vaccinated. We still encourage everyone to get a booster because it does appear to really help prevent infection with Omicron for people who are, eligible. And a reminder that for everyone, vaccine is extraordinarily protective against severe disease.
Next question comes from Elise. Go ahead.
Hi, thanks so much. Yeah, so Dr. Kwonget mentioned that the state is now focusing on sampling the entire state to get that percent of cases of Omicron. So just trying to understand how much that relies on testing and getting those samples to begin with. Basically, how concerned are officials, for example, about asymptomatic spread of Omicron if many of these folks' ability to get tested might start to be limited, as Deedee and Tammy were getting at?
Yeah, that's an excellent question. And the genomic testing is done on a sample of those tests that are positive by PCR. So so there is a large and increasing proportion of cases that are done by rapid tests over the counter at home that we don't have a way of sequencing, and also many of them are probably being many, if not most, are not being reported to public health. So So this is going to be an increasing challenge to have accurate case counts as the proportion of tests that are done at home goes up. Right now, our information about the proportion of variants that are Omicron really is based on those positive tests by PCR, and so as I can see that there could be a time when we'll need to shift to a different strategy as more and more testing is done by rapid testing, as a greater proportion of COVID-19 tests is done by rapid testing, and as PCR is a smaller proportion. We'll have to think of new strategies to carefully monitor and do surveillance for variants that are out there in the community.
Thank you. And our final question comes from Jen. Go ahead.
Yeah, thank you for the opportunity to ask a follow-up question as we're talking about testing. Schools again have been relying a lot on these test to stay protocols. And I'm wondering, now that you've had a fall to look at these different protocols, like, are they working, and what sort of evidence can you share that's demonstrating this, and how is this informing you going forward as you're continuing to advise schools and provide guidance?
Thanks for that question. And for those who are not familiar, Test to Stay is a program in Washington State and other states, and now supported by the CDC nationally, that allows students who are close contacts and not fully vaccinated to remain in school if they are exposed, meaning they're a close contact of someone with COVID-19, if they participate in a regular testing process during their quarantine period. This program has helped us reduce days out of school, so days lost to in-person instruction in Washington State. And I will say our states have done, our schools have done a remarkable job of limiting spread in schools and staying, being able to keep children in classrooms, keeping their classrooms open and keeping their schools open through the combination of layered mitigation and programs like Test to Stay. In terms of evidence, there are also some studies that CDC has done in other states that show a low secondary attack rate among the Test to Stay program, meaning it does help to keep kids in the classroom and limit transmission. So, we're actually very excited to have been at the forefront in implementing this program in our state, and we plan to keep it in place going forward. And because it is a way to keep children in classrooms, which is really important. And we're going to be faced with a lot of demand for this program in the month ahead.
That concludes all of our reporter questions. Lacey or Dr. Kwanget, do you have any final remarks you would like to add?
I think the only thing I would add is, well, just to thank you for your interest in this topic and informing the public, getting accurate information out to them. Again, I think one of the most important things that people can do to protect themselves and their family is to get vaccinated. So if you haven't started your series now, if you've gotten your initial series but haven't gotten boosted yet, now is the time to do that. Because even if vaccination and boosting is not 100% effective at shielding you from infection, as Lacey mentioned earlier, it's highly protective against hospitalization and death. And that's really our goal. How can we keep people out of the hospital? How can we keep them healthy? And vaccination and boosting is the best way to do that.
I just want to thank everyone for their thoughtful questions, and re-emphasize Dr. Kwanget's point. I think the most important things we can do right now is get vaccinated, get people we know vaccinated, help them if they need if you have all-wheel drive and they can get to a clinic, please take them. And then certainly if you're out in public, please wear a high quality, well-fitted mask. We are in a challenging time, but Washington has pulled together so well throughout the pandemic to make a huge difference in severe disease and death from COVID. And we're really calling on you to stick with us through this next wave and continue doing that.
All right, thank you very much to everyone who joined us, to Dr. Kwonget and to Lacey. That concludes this media availability. Happy New Year, everyone.